Hello and welcome to the Screagles Mental Health Safety Kit training video by Counseling and Psychological Services. Today I'm going to be talking through a new initiative that we put together to help you when you are working with students in crisis to know the best course of action and available resources. First of all, why are we talking about mental health and college students? Well, as you can see on the screen, looking at some of the statistics, now is the time that mental health crises start to pop up and become really prevalent for this population. 20% of the population at a given time are struggling with mental health concerns, and 4 out of 5 college students who consider or attempt suicide have shown clear warning signs before the attempt. Today, we are looking at what some of those warning signs are. Suicide is the second leading cause of death amongst young people, second to accidents only. About 67% of people between ages 18 to 24 have depression symptoms and don't seek help, which on our campus is really sad because there are a lot of different available options, and we're going to talk through those today. 44% of college students report symptoms of anxiety or depression, which translates to approximately 4,000 USI students. So when we are talking about the importance of this video, it really becomes a matter of when are you going to encounter a student that needs help, not if you are. And young people with a mental health diagnosis, including depression, are 5 times more likely to attempt suicide than adults. So again, just kind of reiterating the vulnerability of this population. So on your screen is the new Screagles Mental Health Safety Roadmap. So I want to talk about this because we have had a decision tree that was in Counseling and Psychological Services before, but this is a version that has incorporated some evidence-based practice and tried to make the process more simplified for you. So I'm going to talk through this tool, which is kind of the main focus of this video. And then I'm going to show you the tool, the tool that this is based off of, which is another great resource, and then talk about some of our referral sources. So we're actually starting here on the left. And I do understand that since this is a video, these things can be hard to see. This is actually available as a PDF on the Counseling and Psychological Services website as well, for you to access, print off, and share as needed. We also have copies in our office. But at the top, we are starting to look at what are some of the signs of distress and warning signs for students who might appear distressed or you feel might be showing safety risk signs. So when you're encountering a student, these are the things to watch for. In terms of signs of distress, look for things like nervousness, irritability, aggressive or assertive behavior, fearfulness, changes in academic performance, changes in relationships. Now, all of these things are very common. So one of the things I do want to iterate, and I think this is going to be a key takeaway from this video, is that these do not necessarily mean that we're going to make referrals right away, but these are some of the signs that we're going to want to start watching for. And we're going to start figuring out, are we going to make immediate referrals, or are we going to intervene in other ways as well? So what are some other warning signs that a student might be at risk and their safety might be at risk, or maybe a more imminent risk? Well, other warning signs, they could be withdrawing from others, if they talk about or threaten suicide, if their behavior becomes bizarre, alarming, or dangerous, frequently crying, engaging in self-harm, starting to have dramatic weight change, if they are indicating a lack of pleasure and things that they used to find pleasure in doing. All of these can be signs that there's a potential risk involved. Now, if you're starting to see these things, then that is where this tool comes into play. Because usually when you start to see that, you start to get those gut feelings that maybe I should do something, say something, and but sometimes you don't always know what that thing is. So this tool will help walk you through that. So the very first question on here, it says, are you worried about the student safety? And usually you can kind of go off your gut a little bit on this very first part. If you're getting those butterflies that say, maybe there's something going on here that is bigger than me and I need to find out more information, then we're going to be working our way down the left-hand side of this tool. But if you're starting to see these signs, but those butterflies, those red flags aren't going off, and your kind of immediate answer is no, we jump down here to the green section where it says no imminent danger. And under there, we're talking about listening and providing support, referring to resources as needed, but not acting as a therapist. Now, if you want to have good examples of what these different green, yellow, and red areas mean, the back side of the roadmap, or on the right-hand side of this screen, actually walks you through what some of those scenarios are. Keeping in mind that with the students who showed no imminent danger, so individuals who are not talking about suicidal thoughts, self-harm, but are maybe showing some of these warning signs and signs of distress, sometimes they've reached out to you as either an RA or a faculty member or administrator, because you may be one of the few people in their lives who they feel comfortable coming to and feel like your words of wisdom and support can help them get through. And maybe they just need to unload. So it's okay to not make referrals at this point. But let's say that there is a concern, and maybe we have some butterflies, maybe we have some red flags that say we need to think about intervening more. Well, that's where the left-hand side of this tool really comes in to play. So are you worried about the student's safety? Yes. Okay. Well, the left-hand side of this roadmap, and really what constitutes kind of the whole bottom piece, this is inspired by the CSSRS. This is an evidence-based tool that we're going to talk about in just a minute. But these questions help us have a pretty clear indication as to whether or not there may be some unclear imminent danger, or if yes, there is imminent danger that we need to worry about. And the yes/no decisions there will help guide us to the right area. So that first yellow box, you'll see 3 questions. In this yellow box, you're going to ask all 3 of these questions to students. Have you wished you were dead or wished you could go to sleep and not wake up? And in the past month, have you actually had any thoughts about killing yourself? And in the past month, have you done anything, started to do anything, or prepared to do anything to end your life? So if they answer no to all of these questions, especially if it's in the past 3 months, then we're automatically going to jump down here into unclear and imminent danger, which means maybe there's something going on, maybe we need to make some referrals, but at this moment, we don't need to have an emergency intervention. Now, let's say they say yes to any one of those things in the past 3 months. Time frame does come into play here. You will see that listed. And the reason time frame matters is maybe a student has been suicidal in the past, but maybe it's when they were 15 years old. And now they're 19, 20 years old sitting in your office or in your classroom or in a dorm. And so that doesn't, just because they've had suicidal thoughts in the past or self-harm thoughts in the past, that does not mean that there is imminent danger in this moment. But if they were talking about the past month, the past 3 months, especially, then we want to keep asking some more questions. So we jump down the list here a little bit. Another question: have you thought about how you might kill yourself? So you'll see where the yes, no's lead you there based off that question. The next one says, have you had any intention of acting on thoughts of killing yourself, as opposed to you having the thoughts but definitely would not act on them? Again, some yes, no's. And then ask the student, have you started to work out or worked out the details of how to kill yourself? Do you intend to carry out this plan? So you'll want to ask all those questions on the left-hand side. All of those will lead you to different answers. If they're saying no to everything, we're really going to land in the unclear imminent danger. If we land in the red on any of these and we land in the yes imminent danger, it's going to really dramatically change how we choose to intervene with these students. So let's look at some of those interventions. So again, starting with the green, no imminent danger, we're really looking to provide a supportive ear. If we're in the unclear imminent danger, we're going to want to reach out for appropriate resources and consultation. Maybe we're getting them connected to somewhere on campus. Maybe we are reaching out to a department on campus and seeking some additional information to help them. But we are kind of working the steps to figure out that next plan. If they land in the red, we want to do some things right now, because the red is imminent danger, which means they're, if left alone in a short time span, a student may carry forward with thoughts, feelings, actions, plans about how to self-harm or to kill themselves, and we want to intervene as early as possible. So at this point, we're going to want to immediately call public safety, or if you're off campus, we want to call the nearest off-campus emergency resource. We have both those listed on the handout. One of the most important things is do not leave that student alone. Now, if this student is contacting you on an email or by phone, then if you're on the phone, you still want to keep them on the phone to get someone to them. If they're contacting you via email, this is not the right time to put in a care team report. You're wanting to still get an immediate intervention to get someone to that student in that moment. Because if something comes in on a Monday and you put in a care team report, a lot of time may pass before there's an intervention there. So we want to go ahead and get someone to them ASAP. So looking at the other side, again, there are some examples that you can look through to see what is unclear versus imminent danger. Let's look at the imminent danger because these are the ones that are kind of the biggest concerns. If anyone is making direct statements of risk or been noted or have undeniable warning signs, have been reported, or a student is found disoriented, unconscious, or unresponsive, a student reports misusing and or overusing prescription medication, a student is threatening immediate danger to self or others. These are all examples, although not all inclusive of imminent danger. So what are some of the resources available to us? We're going to talk about these in depth in just a little bit, but we've hit the highlights on this sheet so you kind of have them all in one place. But we have some campus resources listed. In the red, you see counseling and psychological services. So that number is our direct number where you can reach out, and we can either get individuals set up for appointments and services, or we can talk to staff or students regarding consultation of what might be appropriate next steps. You also see our third-party providers on there as well, Timely Care and Talk Campus. Timely Care is another mental health provider that provides telehealth services. We also provide telehealth services in CAPS, but Timely Care has some extended hours and evening and weekend options. And they also have a 24/7 Talk Now option that is available to students, which can be really helpful in a moment of crisis. And then Talk Campus is a peer-to-peer support mental health social media. And these are both have app and browser access, and they're free for USI students. And then also listed for campus resources there in red, you see public safety, the emergency contact. I would highly encourage that if you don't have this number in your phone, to please add that. And we also have some other links on there too. You see the care team. If you need to put in a care team report, this may be for the no imminent danger or unclear imminent danger. If you feel like maybe some additional involvement could be helpful, then you can put in a care team report and there'll be follow-up with that student. Then we also have some off-campus resources. So in red, we have the Southwestern Crisis Line listed on there. And then the off-campus national line, we also have the National Suicide Line, that's 988. And we have their older lifeline, which is 1-800-273-TALK. Both of those work. The 988 is the newer line that is currently being implemented as we speak. Now, this screen that you're looking at, this is the Columbia Suicide Severity Rating Scale. This is where those questions came from on the roadmap. And if this is easier for you to use, then I encourage you to access this as well. We also have this on our website for you to access. And what you could do is you could use this to really quickly indicate what a student's needs are. They also have an app. If you go to the Columbia Protocol app, then there is an application that walks you through all these exact same questions. But very quickly, very clearly, you ask these questions directly, and then you'll know, do I need to make some immediate referrals or no? Now, I want to talk about one other thing regarding suicide prevention, and that's QPR, because QPR concepts have been around our campus for a long time. And so I just want to tie in, if you already have these skills, how do we then use the roadmap in the CSSRS? Well, QPR stands for Question, Persuade, Refer. And so we want to question about someone's safety, persuade them to get the appropriate resources, and then actually refer them as necessary. So some of the questions we have on here are good lead-in questions to the CSSRS. Have you been unhappy lately? Do you ever wish you could go to sleep and not wake up? Sometimes people who are struggling might wish they were dead. Because I care about you, I want to ask you a set of questions. Now, the CSSRS questions on the previous slide become a great tool for you because you don't have to come up with these questions off the top of your head. You can just pull these out if they're on your app or if they're in your desk, and you can just work through them, right? And so it really kind of takes some of the pressure off of you. And just to address a quick myth here about talking about suicide is that if someone is not currently thinking about suicide, asking them suicide questions will not put that idea in their head. So feel free to ask all those questions and do so with confidence because they know that that's coming from a good place. And if you cannot ask the questions, find someone who can, because again, if those red flags and those butterflies are going off, then it's a good indication that we need to at least take it a step further. So if they say that, yes, I need some assistance, then use your active listening skills and try to help guide them towards the referrals. Help them understand the importance of getting connected, and then help refer them. So on the referral side, in red, I have written utilize Screagles mental health safety kit for appropriate referrals because we have the list of examples, we have the on-campus and off-campus and national resources. And don't be afraid to seek consultation or ask questions about what a referral source can be. For example, things like Talk Campus and Timely Care, our CAPS partners. If you have questions about those and are confused about them, then please ask us about them. We're happy to walk through them. On this slide, we're looking at campus resources. On the campus resources, the top picture is our CAPS main website. If you are wanting to get connected to any of our third-party providers or to set up an on-campus appointment, then you'll just go to USI and search CAPS, and then click on one of those blue boxes, and we have some text that helps guide you to the right place. And you can actually come on here and set up whatever services that you're in need of. And we actually have a whole other video about how to access CAPS resources on our website as well to help clarify some of these. And then on the bottom left, you'll see some more information about Timely Care. We have really easy access to get to Timely Care through the My USI waffle. You'll see that blue talk bubble. That'll take you straight to their website. And then on the bottom right-hand side is Talk Campus, a little screenshot there that shows the mental health social media that is the peer-to-peer intervention that we were talking about. And that is monitored by mental health professionals. And then, of course, the power of public safety, in any emergency, contacting them in imminent situations is the go-to option. 777 from any campus phone will get you to them. And if you aren't at a campus phone, make sure you have their full phone number in your contacts. And then looking at the community at Broad, sometimes it may make more sense based off of who you're talking to, where you're at with them, that you're making a referral to the community. And so just wanted to list a couple of the big ones here in the Evansville area. We have Brentwood Springs and St. Vincent and Deaconess. If someone needs to go inpatient into the hospital, these are going to be your big three in our area. One thing that is really important about the CSSRS is that the three providers I just mentioned use a clinical version of that same tool. And public safety and the sheriff's office also are familiar with the CSSRS. And so in using that tool, we can help individuals as we're making referrals and bringing other people in those emergency situations, help them understand the severity of the situation. So if we were making a referral to Brentwood, for example, we can say, we did the community-based CSSRS when we were together, and by answering X, Y, and Z on these questions, it indicated that they need immediate services, and we talked about our options, and they were willing to go to Brentwood. And so you're taking that information, you're speaking in a common language that someone who is untrained in mental health can still have that language, and then you're helping to pass that information along in a helpful way to the clinicians who are going to make the judgment for the next steps. We also have the Trevor Project, which is an LGBTQ crisis line. We have the National Suicide Prevention Lifelines, both the 800-273 talk I mentioned and the new 988. Albion Fellows Bacon Center, if you're struggling with a sort of domestic violence or intimate partner violence. And then the Southwestern Crisis Line as well, 812-422-1100. And they also have some additional services in addition to their crisis line, including a stabilization unit and mobile response unit there as well. So that is a really brief video to walk you through the Screagles Mental Health Safety Kit. We are happy to provide a bigger, longer, more in-depth, customized training for any of the student groups, administrative groups, faculty groups here on campus who would be interested in learning more about how they can utilize this with their specific students and in their specific areas. So please don't hesitate to reach out and contact us. CAPS is always here for consultation and to serve our students in the best way possible regarding delivery of mental health services. Thank you for listening as always. Go Screagles.